Thank you. I'd like to get your reaction to the information put out by the BC COVID modeling group. It's predicting a tidal wave of Omicron by the end of the first week in January, followed by a hospitalization rate that will exceed BC's capacity. What do you make of those conclusions?
Yeah, I think modeling has been helpful for us from the very beginning, but I go back to what I've said from the very beginning. Models are dependent on the inputs that go into them, and there's still much that we don't yet know about Omicron in particular, about how it's spreading, and about severity of illness. So by necessity, all models are wrong. Some of them are really useful, and this modeling group has been part of our team. We have others that we look at as well, and being able to look at all of the different models gives us a sense of what potentially could happen. But I think what we need to focus on is that we can do things to control this. It's not a prediction of what's going to happen in the future. What it is a set of parameters that could happen. And what we are seeing is the actions that we take can make a difference in what the outcome is going to be. So we still do not yet know about severity of illness in our context here in BC, but we do know that the things that we can do right now can slow this down and can help prevent that impact on our healthcare system. And that's what we're asking people to do right now.
Lisa, do you have a follow-up?
Yeah, I wanted to ask about the vaccination and the booster program. Why have you not used medical students or even trained people to set needles instead of, redeploying healthcare workers from hospitals to do it?
We actually have. You'll remember some months ago, well, actually a year ago, I actually signed an order, and it's up there on our website, that shows all the different groups of people. So we have medical students, nursing students, physio and OT students, all health professional students who have been trained specifically on vaccinations, who are working in our clinics. We have paramedics, firefighters, pharmacists, pharmacy technicians. We have expanded it dramatically to a whole class. Dentists, chiropractors. We have many people, including retired and recently retired nurses and physicians and other healthcare providers. So we have expanded that dramatically some time ago, and we're pulling people back in to support the latest booster efforts too.
Next question is from Christopher Folds, Kamloops This Week.
Good morning. You touched on the gym closures. And part of the health order recently was the gyms are closed and sports tournaments are canceled. The provincial curling championships in Kamloops were initially canceled, but I understand there's been an exception made for them, and they will go ahead under certain protocols. We have a group of business gym owners in Kamloops who remain open, and they cite, as you mentioned, the need for the mental health help the gyms offer, and they are staying open. Is there anything that can be done like you did with the sports tournaments to allow gyms to stay open through this period?
So gyms must close during this period. There are things that we can do, and my gym does it very, very well, to connect people to be able to support us having that physical activity remotely right now. What we are seeing is that this is passing so quickly in those indoor environments, even when we have lots of space and when we've been doing everything right. And I want to say that I've met with some of the representatives from the fitness and gym industry yesterday, and they have been leading in making sure that we can do things as safely as possible. Right now we're in a place of real uncertainty with a lot of transmission in younger people in the demographic that really is connected to their gyms. So they must right now stop that. In terms of the one bonds bill that I understand we're looking at, it really is about trying to have the higher level competitive sports being able to do things in a certain way. So there's no spectators. There's a whole variety of things that are involved in that. And I will say that the ultimate decision has not yet been made on whether that will continue or will go ahead. It much depends on what happens in the next week.
Do you have a follow-up, Christopher?
Yes, thank you. Part of the gym owners sort of, I guess, their frustration, and I've heard it from other people, is what seems to be to the layman like myself and others, the kind of inconsistency in the orders. The Real Theater is a prime example. They could not operate as a movie theater, but they could as a sports pub. The vaccine card mandate, the customers must be vaccinated, the employees don't have to be. And then on that gym note, the YMCA here in Kamloops says their gym area is closed, obviously, but the sauna, the hot tub, and the much smaller enclosed pool area remains open. So is there room for a better explanation for the rationale behind this for the layman?
Yeah, so you're talking about several different things that have different impacts. And yes, it's very much trying to find the balance of the highest risk activities. And yes, movie theaters were at a higher risk, and we have now tried to address those. So we know that seated events, when you're not exerting, and right now one of the reasons why I've been focusing on those areas that are indoor where we're exerting, so gyms being a classic example, is that we are seeing a lot of transmission now through the very small droplets and aerosols, and the measures that we had in place that were working for Delta, for the other variants that we've seen, are just not enough at the moment. It's spreading very rapidly, even amongst people, and because of that shorter incubation period, it's before people can notify that next generation of spread. In terms of the BC vaccine card program, and I've said this many times, it's my responsibility to put in place the public health measures for people who are attending those places. It does not mean in any sense that workers in those places don't have to be vaccinated. It is their workplace that makes sure that employees may live up to the standard that's needed in that workplace, and if there's transmission in those workplaces, they will be shut down. So we have different measures in place for workers. And, of course, people who work in the hospitality industry, for example, cannot go to stay in the restaurant or go to visit a movie theater or other place unless they're vaccinated. And I know that across the board, most of the restaurants, for example, staff are vaccinated because they recognize the importance of protecting themselves in their workplace.
Next question is from David Mulco, CTV.
Dr. Henry, David Mulco at CTV. I want to talk a little bit about testing and testing strategy. I appreciate the clear clarification around that. Folks who have been in these lineups this week, as you can imagine, have called it organized chaos. Perhaps that is being generous. But my question for you is, how is it that we're in this situation, given we had at least a couple of weeks of lead time to prepare, and what are we doing now to ramp up our testing capacity for the weeks to come?
Yeah, I think our testing strategy has always been to use the PCR testing for those who need it, where it changes your clinical management, or for people who need to have an accurate negative test so they can work, like healthcare workers, for example. And yes, you can say that we have been planning. The maximum that we actually, capacity that we have in terms of machines, in terms of people in this province is about 20,000 PCR tests a day. That's our maximum. That is how we have planned. You can't create people to work in a lab out of nowhere. And that is part of why we need people to focus on, and we've been saying this from the very beginning, testing is for people who have symptoms. And we need to really focus on that. And part of our rapid testing strategy has been to supplement that. And now we're using that particularly in our testing centers for people who are at lower risk of having more severe illness. And so our rapid testing is able to support people who have symptoms and being able to determine who's got COVID and not. So it is a challenge, but you know, the challenges we're facing across the country and around the world. This is spreading very rapidly, very quickly. And we ramped up to the maximum capacity that we have here right now in this province.
Follow up, David?
Yeah, one of the things I also want to ask you about, I think I'll leave gyms alone because that's come up a few times and you've answered that pretty clearly. But just talking a little bit about the inconsistency in terms of closures and capacity controls. I personally have been in sort of different retail shops, malls, spots where there are no capacity controls, where there is no distancing, where people are sort of on top of each other. And I don't want to be a Grinch because it's Christmas Eve, but help people understand, you know, okay, gyms are closed because people are exerting, but why not bring in capacity controls for malls, for retail shops, bring it down to 50% or 25% if that is a risk as well, and we're seeing people gather in those locations as well, Boxing Day coming up and so on. Your thoughts?
And you'll know that we put in orders around what's happening on Boxing Day and other sales, and we've been working with the retail associations. It's a qualitatively different situation, and this is really important. This is where, we have put in the mask mandate in all of those settings, and I know many, many retail settings are doing a very good job at capacity limits, and we know people were pushing that. We've become a little bit complacent as we are making our way through what was our last wave in Delta. We need to step that up again now. And that means all of us doing our bit, thinking differently again, going back to recognizing that Omicron is different. It is spreading faster, it's spreading much more quickly, so we need to go back to giving people space. We need for retailers to limit people, limit those capacities, give people the distance and the space. But we also know that those transactional settings where you're moving past somebody, where you may be standing a few feet away, everybody with your mask on, with the increasing ventilation or the larger spaces, those are less risky environments. It really is the workers in those environments who are most at risk, and that's why, once again, we need to go back to using our COVID sense, as the minister would say. So yes, everybody now, make sure you wear your mask. If you're somebody who cannot wear a mask, then you can take curbside pickup, do online. There are other ways that you can get what you need without going into those indoor environments. And everybody, I'm appealing to you again now. We need to take a step back and recognize we're dealing with something that is different, that is moving through all of us. So be respectful, wear your mask, keep your distance, and be patient with each other. It's going to be a challenging few weeks until we actually understand how this virus is going, this strain of the virus, how Omicron is going to move through our communities, and we need to do that together.
Keith Baldry, Global News.
Oh, hi there. Thanks for taking my question. Regarding the concerns of people going to get tested when you don't need to be tested and basically using up these PCR tests, are any changes being made to procedures at the testing stations in terms of who can get tested? I had a caller on the radio this week tell me that he was in line for 3 hours in Coquitlam and suddenly was taken out of line. He was 40 years old, and he was told that only people over age 65 as of that moment were going to get PCR tests, that everyone else was going to get rapid tests. So again, just given the concerns, are procedures changing at the testing stations?
Absolutely, and they have, as we have understood more about transmission and risk. So yes, there is triage happening at the testing stations, particularly in Vancouver and the Fraser Health regions where we've had long lineups, and here on the island. So we are using the rapid antigen test to supplement PCR testing, and PCR testing will, depending on the situation, people will be triaged, and if you are younger and don't have underlying risk factors, and particularly if you're vaccinated, then rapid testing may be the most efficient way for you to get what you need. And for people who may have underlying risk factors for more severe illness, and that usually is people who are older or younger, especially younger children, then you will be prioritized for getting the PCR tests.
Do you have a follow-up, Keith?
Yes, more about the psychology of what's going on right now. With so many people double dosed, is it harder to get through to those people with to express the urgency of the situation? Many people probably think they're bulletproof right now with double doses, and obviously they're not. What can be done to get through to them?
You know, I just think, and we've been trying to say this as we've learned more in this last week, that the game has changed with Omicron. We're in a different pandemic again. And there's some positive things about it. I think the fact that we have so many people who have got their vaccines means that hopefully we are going to get through this without having a lot of severe illness. And so far we're seeing that. It's a little bit hard to tell because it's mostly younger people and younger people who have stepped up and got their vaccines. So that is the really positive thing we're seeing about this. But we need to change our behaviors, and we can control how this virus is going to affect us by doing those things that we know worked way back then in March of 2020 before we had vaccines. So on top of vaccines, we now have other measures that can help too. So we need to go back to those other measures, and we need to really recognize that this is spreading really quickly, mostly causing mild illness in younger people who are vaccinated, and that's great. But we do need to change our thinking. It's not, the things that we were concerned about that we could do with Delta are not necessarily working anymore. So we have to be that much more careful right now. And I talk about, we're learning that it's binding more to the upper airways, which means we can get a lot of virus that can spread very quickly, very easily, and especially in indoor environments, in very small droplets in the aerosols. So it is thinking differently to get us through this period of time. And the one big question that we don't have yet, fully understand yet, is how severe this is going to get. What's the impact going to be on our hospitals? So the timing is the worst. I know that. I think we're all feeling that. But this is going to be a Christmas where we have control. We can do things, and part of that means sacrificing again and supporting each other to stay away if we're feeling sick at all. And we will get through this by doing that. And I'm sure the Minister will have some comments on this too.
Go ahead, Minister Dix.
Clearly, as described today, and as we've been seeing in the numbers here and everywhere else in the last week, 9,500 cases announced in Ontario today. Have changed significantly. In Vancouver Coastal Health and in Fraser Health, we had an average test positivity of about 2% in the period leading into Omicron, and that obviously people were adjusting to those circumstances at that time. We've now seen those levels go up 8-9 times in the course of a week and a half, and that requires us to change our behavior. I want to note that, for example, yesterday the 2,000 tests were based on 20,133, so expansive testing and a high test positivity as a result of that. Essentially 20,000 tests and 2,000 test positives is across the province, a 10% test positivity, which is an increase across the province of about 3 times of what it had been a couple of weeks before. So we do have to adjust and change as a result of this, and it is difficult to adjust and change because we've had to adapt a number of times, but I believe that people are absolutely prepared to do that to keep themselves safe and healthier, and to keep the ones they love in their communities safer and healthier, and to protect the healthcare system, and we need people to do that right now. You're going to see, and I didn't mention this earlier, but we're going to see this afternoon, we're going to be providing that bulletin for everyone, so me on the phone with all of the regular case and hospitalization data and critical care data, and that'll come out about 3 o'clock today, and so you'll see those numbers, including all of the usual numbers and the updating of the dashboard on Monday and Tuesday. Of course, you're going to get the case numbers, and then on Wednesday we'll be back with a full briefing on all of the numbers, so you'll be able to see that. But what I encourage people to do is to see what's happening here and what's happening everywhere, and to change our actions accordingly, and to reduce, in particular, our social interactions. That's what we have to do right now, and I strongly encourage people to do that.
Next question is from Graham Wood, Glacier Media.
Well, hi there, Dr. Henry. Dr. Henry, is COVID, is this Omicron variant airborne? Omicron.
I think, when we look at COVID, when we look at COVID, all of the SARS-CoV-2, which in various different forms, it's been transmitted through the air. Absolutely. We've said that from the very beginning. But the relative importance of the different size of droplets depends on the infectiousness of the different strains. So it becomes much more important to have protection against those aerosols, those smaller droplets. And really it's a combination of physics. So if a smaller droplet, an aerosol, has less virus in it, but if that virus is more infectious, you can get infected with the smaller droplets. When we initially saw early on, you needed a larger dose of the virus. And so it was much more important to look at protecting yourself from the larger droplets. But it can spread from all of them. And that's what's so important right now. So in terms of the the definitions that we use in the healthcare setting for airborne transmission, it really talks about viruses that can be suspended in the air and travel long distances, and we're not seeing that behavior, the behavior that we see with measles or chickenpox, for example. We're not seeing that behavior and how this virus is transmitted. But what we are seeing is that those aerosols become more important with the higher transmission variants like Omicron. So that's why it's so important right now that ventilation is much more important. Staying out of those indoor settings where we're having close conversations with people without wearing masks, making sure we have an appropriate mask for the situation that we're in. So if we're going to be indoors with a group of people for a period of time, then upgrading to a medical mask or an N95 if you can handle how the N95 fits, or a medical mask with a good quality cloth mask over it that helps mold it better to your face. So all of these things are wrapped up in how this virus is transmitted. But it becomes much more important with viruses like the strains like Omicron, for sure.
Graham, do you have a follow-up?
Yeah. Are you still comfortable with the Canuck game proceeding on Monday?
Obviously, we're looking at these on a day-to-day basis. We know that the increased space in some of those larger environments, we've now, of course, increased capacity, the importance of mask wearing, continuous mask wearing, which we've not always been adhered to. So we're assessing these on a day-by-day basis.
Next question is from Rob Monroe, Info News.
Thank you, Dr. Henry. I'm just a bit confused about the numbers. We had 2,046 new cases yesterday, but the data said there was 975 Omicron, which is the total we've had so far. So how long is it going to be before the Omicron is the dominant strain, and why are so many people must be getting Delta?
Yeah, so the Omicron numbers are those that are confirmed by whole genome sequencing, and so there's a delay. So we are seeing that the percentage of cases on a day-by-day basis that are Omicron compared to Delta is rapidly rising, and it's over 50% now. We expect it to be the dominant strain this week. So that's what we're seeing. So people who get a positive PCR test, they're notified right away. That's what we report on a daily basis. So the 2,000 people were people whose tests were reported yesterday. It takes a delay of several days to get the whole genome sequencing. So what we get is a trajectory of what we're expecting. So most of the cases, the 2,000 cases from yesterday, will be Omicron.
Follow-up, Rob?
Yes, we're trying to get some clarification on the rules for in-home visiting, and you said 10 individuals or one household if it's larger, but could we therefore have 10 people from 10 different households come and visit us tomorrow for Christmas dinner?
You could, but that is not our recommendation. We want people to keep it small. But there are some groups of people who are close connections. They may be sisters and brothers in a family who come from different households. But so a maximum is 10. That is reducing your risk. But you know what? Right now, people need to think, if I have any symptoms at all, even if I think it's just the sniffles or a cold, then I don't want to be around my new nephew or niece, or don't want to be around my grandparents, or people who might have more severe illness if they get sick with this. If you have any symptoms, stay away from the gatherings right now. Keep those groups small. If there's anybody who has immune compromising conditions, people going through cancer treatment, find ways to connect with your family and your close friends in ways that aren't going to put you at risk. This virus is spreading very rapidly. The 2,000 positive cases yesterday are just the ones that we tested. We know that there are many more people that didn't go for a test. There are many more people who are just doing the right things and staying at home. So we all need to rethink how we spend the next few days. And if you have any concerns at all, put it off. find a way to connect, as I will be doing with my family who don't live in this province. Find ways to connect that are meaningful and that will get you through this period of time. And I know that means for some people, disappointingly, you're going to have to reassess your plans, do the home delivery of turkey and meals. We've seen a lot of that. That's how we get through this together.
We have time for one more question this morning. John Hernandez, CBC.
Good morning. Could we get answers for both in English and French for these? But first, Minister Dix, what advice do you have for employers in non-essential sectors who currently require proof of a negative COVID test for employees with any cold or flu-like symptoms to return to work if not everyone can get access to testing? Also, earlier in the pandemic, people who tested positive were prioritized to be notified. Those who were waiting longer to hear were negative. Is that happening now?
Go ahead.
Sure. Just to say that
Sure. Just to say that all the testing now is automatic for most people. There's some people that get a call, but most people get a text or a message. So that's whether you're negative or positive. So the testing notification is going out right away to people. So that has changed from very early on in this. In terms of employers, right now there is programs in certain businesses, particularly some of the essential businesses, where there's sequential testing, and that obviously can continue, and we need to make sure that for those people who have symptoms that they can get the accurate tests, and I talked about emergency services, healthcare workers and others. For those settings where right now they're not essential services or there's a pause over this period of time, then the best advice right now is if you don't need to go into work, if you can work from home, you can do that from home, then that is the recommendation right now.
Go ahead, Minister Dix.
C'est que les notifications sont plutôt automatiques, donc pour des gens, on reçoit des renseignements assez vite après test positif. C'est déroulé depuis beaucoup de mois, depuis vraiment le commencement de l'année. Donc, on voit cela un peu partout. Mais notre recommandation, bien entendu, c'est que si on n'est pas essentiel et on peut travailler à distance, c'est important de le faire, surtout maintenant. Donc, je pense que ce que la Dr. Henry vient de dire, c'est important pour tout le monde. Bien entendu, on va avoir beaucoup de discussions ici, le recommencement pour un grand nombre de gens le 3 janvier ou le 4 janvier. Mais pour l'instant, il faut être prudent dans tous les éléments, que ce soit dans notre contexte personnel ou au travail.
John, do you have a follow-up?
Yeah. Can you clarify the test positivity rate in Vancouver, Coastal, and Fraser Health? Minister Dix mentioned 10% across BC, but how high is it in the urban, densely populated areas? And also, can you expand a bit on what you said about people who have already had COVID getting reinfected with Omicron? How often is that happening in BC? And again, both in English and French.
Yeah, I can start with the...
Start with the... Sorry, I've forgotten already what the first question was. The test positivity in Vancouver, Coastal, and Fraser, it's still just under about 10% from yesterday's numbers, but it has increased, and as the Minister said, it increased from around 2%, which it had been at for quite some time in those areas. So yes, 10% in the large urban areas with large numbers of people is very high numbers of people, and that's only the people who were tested. So that's one of the reasons why we're putting out this message today about if you have any symptoms at all, reassess your plans right now. Don't go to gatherings. Stay home. Take care of yourself. Sorry.
Positivity is it's 10%. We're moving to 10% as a 7-day rolling average in the Metro Vancouver Health Authority. So when you see a climb in
in cases and test positivity, and you're doing a 7-day rolling average, you're dropping off the first day and you're adding the next day, and obviously the trajectory is significantly upward. So we had yesterday, and I'll get you the exact numbers, but it was 1,621 cases, health authorities. So that's a test positivity, a 1-day test positivity well over 10%, and a 7-day rolling average that's approached 10%. And so that's significant. And if you look at across the province, because the Vancouver Coastal Health right now has moved to having the highest test positivity that in the last number of days, you'll see that reflected slightly differently, but it's going up everywhere. I should say that people in the north and our healthcare workers in the north have been dealing with 15 to 20% test positivity for months, and doing an exceptional work under those circumstances. But we saw the effect of that with the less transmissive Delta variant, although the Delta variant has had a very severe effect, especially on unvaccinated people, and indeed continues to. So those are the rates, and I'd be happy to give you the precise numbers on a daily basis, but also the 7-day rolling average by health authorities, which is obviously going to go up again today because it's significantly higher yesterday than it was 7 days ago.